What is clinical hypnotherapy, and does hypnotherapy works by itself? And why in my practice I combine hypnotherapy, motivational interviewing, and foundations from other approaches, and I always do integration works. Also, we're going to talk about what conditions are most treatable, or in what conditions hypnosis works in the best, and I'm going to tell you how I specifically integrate hypnotherapy, clinical hypnotherapy, in my work. Also, we're going to talk about like different types of like hypnosis. Well, like mostly the difference between stage hypnosis and clinical hypnosis, clinical hypnotherapy. So if you're new to my channel, my name is Eugene Perez, and I'm a registered hypnotherapist in the state of Washington. And prior doing hypnotherapy as my main focus, I worked as a therapist in Moscow, Russia. I worked as a therapist for many, many years. I have a master's degree in psychology. When I moved to the United States, I did not start as hypnotherapist at the get-go. I actually work in behavioral health field as a case manager, social worker, youth counselor, and I decided to bring hypnotherapy to life in my private practice in 2026 because I have seen from my previous experience how hypnotherapy with a combination with other modalities can actually transform, truly transforms people's life. So let's start with the definition. Clinical hypnosis and is a state, or hypnosis is a state of consciousness involving focused attention that goes within, like inside focused attention, and reduced peripheral attention. So what is peripheral attention? Attention, what's happening around you. So you rather focus on the inside, what's going on inside versus what is going on the outside. Clinical hypnotherapy uses hypnosis, uses this state of consciousness and focus awareness and trance-like state to actually deliver suggestions. Suggestions those are kind of like commands in a way that can help people heal. One of the most prevalent figures in hypnosis is Milton Erickson. He is a psychiatrist, and I have huge respect for Milton Erickson. He is a true healer. He really cared to help their patients to get better. He used very indirect hypnosis, and there are a lot of videos with him. He had this really calm voice, how he conducts hypnosis, and he studied tremendous work. And if I were to kind of summarize his work, it's all about speaking the client's language, understand how clients talk about their problems, their struggles, and rather operate in their paradigm. And this is exactly what he did with hypnosis. And we later on call it Ericksonian hypnosis. So, does hypnosis work by itself? Yes and no. Because in my opinion, and this is exactly why I always combine hypnosis with something else, I bring IFS, internal family system, and as a nice philosophical and clinical foundation to apply hypnosis. I bring motivational interviewing, which I'm going to talk about a little bit later on in this video, how I combine it. And I bring integration and like guidance and coaching so people can actually implement what they learn in hypnosis. So the most common, I actually did a little bit of a research. So the most common conditions that are extremely treatable with hypnotherapy and hypnosis, it's interestingly enough, it starts with the medical procedures such as IBS, hot flashes, gut issues. And also has good foundation for anxiety, stress, feeling uneasy. It has mixed reviews for sleep, depression, and weight management. And I'm gonna tell you why exactly. And it has kind of questionable data about smoking cessation. And I'm also can clarify why hypnosis sometimes really doesn't work for smoking, because I smoked for 20 years and I quit. And the way I quit, hypnosis, one of the steps, but it wasn't the final step for me to quit smoking. So, other things and this is the research. This is what the research that we know that exists. Also, in the field of psychiatry, in the field of psychology and psychotherapy, we drop hypnosis on the floor and nobody is picking it up except for clinicians, doctors who are highly fascinated by this methodology. They use it, and they're very far and few between professionals, mental health professionals, who know how to use it correctly, simply because the industry just lost interest in hypnosis altogether. Coaches, life coaches, certified hypnotists who may or may not have background in human psychology picked it up and also use a variety of coaching programs. As you know, coaching can be Wild West. A lot of people do really, really good progress with hypnotherapy, with hypnosis. But also there are unfortunately bad actors, because again, this is Wild West. It's not strictly regulated in a lot of states, this is kind of where we're at. So important how I actually work with hypnotherapy, because okay, you know this background, you know the story. So I use hypnotherapy specifically as a tool to help people to be more resilient, to be more strong. Pain management, absolutely. I had success stories when people would come with stiff necks, and after a session or two, it would just go away. Inflammation in the body, or let's say when people have any kind of mild injuries, hypnosis help to expedite healing along with other remedies. So people normally will recover faster. When it comes to psychological remedies, for example, stress after divorce, anxiety, midlife crisis, when people try to figure out where to go, hypnosis is a wonderful, wonderful way to go inside and to manage stress, to find your pathways. Now, and that works amazingly well, because and this is actually, studies suggest that you can actually Google that, and I will attach that in the description for this video so you can see the studies. So where the studies kind of lagging, because we kind of drop on the floor, we have CBT, cognitive behavioral therapy, we have psychoanalysis, we have EMDR, we have DBT, we have new therapies, and simply clinicians lost interest, because one, you really have to be skillful in the modality for it to produce really good results. And also because it was hypnosis by itself is kind of it's a good technique, but it has to have really strong foundation. And because people did not have that strong foundation, results were skewed or all over the place. And that's why in therapy and psychiatry, we kind of lost interest in hypnosis specifically, not because hypnosis didn't work, but because we didn't know how to implement it correctly. Nowadays, when I talk to clinicians, when I talk to licensed mental health professionals, I actually recently had a conversation with a clinical director. People legitimately don't know what hypnosis can do. And why would they use hypnosis when we have EMDR and other things? And that comes to another portion of my video. I use hypnotherapy, clinical hypnotherapy, with motivational interviewing, and IFS is the foundation of my entire work, internal family system. And as an approach developed by Richard Schwartz, this is extremely congruent with hypnosis, because it is often I ask clients to go within to see the parts, and the premise of internal family system that we have multiplicity of mind, we have different personalities in our mind, and it's not pathology. It is not pathology. It's how our minds are created, and that is the foundation. Motivational interviewing is also another modality. Is a specific way to provide coaching, counseling when people may not have clarity. And this is the most differential thing in the service specifically I provide, because we are ready to establish that hypnotherapy by itself needs a strong foundation, aside from just hypnosis itself. So when we combine motivational interviewing, and in hypnosis, normally we have pre-talk. So how it works, pre-talk, person comes to hypnotherapist, lays out what they want to work with, how they want to get better, what is the end result, and then hypnotherapist induces hypnosis, like kind of makes like hypnotic induction, and it's when person kind of helps. Hypnotherapist helps person to go within to actually get that focus and attention on inside versus the outside, and then hypnotherapists can provide suggestions. This is a very basic explanation of what hypnosis is. So now a lot of people, and this is why, like in one of my previous videos, I talked about why talk therapy may not work. Talk therapy is amazing. I'm not bashing talk therapy. I used it like many times. I'm a huge advocate, and I think it is amazing. But sometimes, and this is where motivational interviewing comes in, people don't have clarity what they want. Let's say somebody is going through divorce. They come to therapist. I want to feel better. What does it mean? There's a lot of ambivalence in that statement, like, I want to get over my ex. What does it mean? Does it mean you want to restart and reestablish your life again? You want to date again? You want to feel less depressed or not depressed? You want to reduce your suffering? What does it mean? So, and this motivational interviewing really helps. And also helps to uncover your patterns, right? Maybe you are noticing maybe there are patterns that are not don't serve you really well. Motivational interviewing is amazing at identifying them. And when I personally combine motivational interviewing with the spirit of internal family system with clinical hypnotherapy, that produces amazing results, specifically with difficulties for adjustment, pain management, absolutely, stress management, absolutely, medical issues. For medical issues, I'm going to give you a fair warning. I need a note from your doctor that it is okay for you to use hypnotherapy as a supplement for treatment to expedite your healing, either after surgery or after injury, like chronic pain, you name it. Like, that is a really, really good application of hypnotherapy. And this is actually what is in the studies. So there's another form of hypnosis, stage hypnosis. It's mostly for entertainment. The mechanism is very similar. I don't use stage hypnosis. I'm not an entertainer. I'm trained professional who worked almost a decade, like pretty much a decade, as a psychotherapist in Moscow, Russia, and work in behavioral health in the United States. And now I bring that experience with hypnosis, with psychotherapy, with knowing other modalities into my practice, and this is how it combines all together. Now, let me know in the comments if you ever experience hypnosis. What is your experience? And tell me if any of this information is new for you, because I'm kind of curious what you want me to cover on my channel. Because in good hypnotherapy, my private practice, I focus this is a combination of clinical hypnotherapy. I'm registered hypnotherapist in the state of Washington, and I work with guys all over the United States. But I focus on personalized guidance through motivational interviewing and hypnotherapy. And it's always a resource for people who may try talk therapy and it didn't work quite well, or maybe they would like to try alternative methods. Hypnotherapy works. Also, it's important to emphasize that a lot of business entrepreneurs, athletes, people in high demanding careers use hypnosis to improve performance. And it's well documented, that high profile executives, athletes, they do use hypnosis to improve performance. And there are coaches and hypnotherapists and hypnotists who specifically work with elite clients like that and help them to actually improve their performance. Now, I would like to hear from you what resonated with you from the video, and also what other questions about hypnosis I can answer.